Hello, and welcome to Bleeding Disorders in Emergency Care. My name is Dr. Deanna Maida, and I am the Medical Director of the South Texas Comprehensive Hemophilia Treatment Center in San Antonio, Texas. We created this video to help paramedics and first-line healthcare workers more effectively respond to a person that has a bleeding disorder. We will cover a basic overview of bleeding disorder diagnoses, including common clinical presentations and treatment plan recommendations. Our goal is to optimize clinical care for patients with bleeding disorders through education and fostering discussion. Before you watch this video, take a moment to think about the current standard of care. At the end, we encourage you to assess and implement any improvements to your current practice. The blood clotting cascade is complex. If one piece is missing, it can have downstream effects. There are a variety of bleeding disorders. Von Willebrand disease, hemophilia, other factor deficiencies, and platelet disorders are just some of the bleeding disorders that you may encounter in an emergency setting. Hemophilia is a disorder in which the blood is missing one of the main clotting factors and cannot clot normally. In these individuals, even a small cut or minor injury can lead to excessive bleeding. Bleeding can be rapidly managed with a strategic approach.
In emergency care, paramedics should be aware to the different approaches to treating patients with bleeding disorders, and, in some instances, a medic supervisor may need to be called to access a patient's port, assist with medications, or provide whole blood infusions. As with any suspected trauma, the Marches protocol should be followed for massive hemorrhage, airway, respirations, circulation, head injury, hypothermia, and everything else. It is important to note that while there may not be any physical signs of a massive hemorrhage, a person with a bleeding disorder may have significant internal bleeding. Additionally, a suspected minor traumatic event can cause a massive hemorrhage in patients with bleeding disorders. There are several sites that can cause life-threatening complications due to bleeding in an enclosed space. These include the head, spinal cord, neck, thorax, abdomen, pelvis, eyes, and limb compartments. Suspected bleeds in or trauma to these sites require immediate assessment and intervention. The gold standard for treating any bleeding disorder involves replacing the missing clotting factors as soon as injury has been identified. Depending on disease severity, patients may need prophylaxis or regular infusions to maintain hemostasis and prevent excessive bleeding. Many patients will have prescriptions for their factor medications that they can self-infuse at home. All patients should have an emergency factor plan for traumatic events. Hemophilia treatment centers educate patients on self-infusions, care plans, and best practices. Some patients may present nonspecific symptoms including restriction of movement, swelling, heat, and redness on and around the joint. In these cases, packing hemostatic gauze or using tourniquets will not stop a bleed, and IV factor replacement may be indicated. Dr. Maida and the South Texas Comprehensive Hemophilia Treatment Center have developed a 5-count hemophilia assessment in order to provide emergency treatment guidance. 1. Confirm the bleeding disorder and confirm the need for immediate factor infusion. 2. Ascertain availability of IV factor product for infusion in the field. 3. Determine if this is a minor versus major bleed. 4. Identify and secure IV access, keeping in mind the patient may have a central line or fistula. And 5. Review factor dose based on bleeding classification. Mix factor and infuse as directed. Direct any urgent questions to your immediate supervisor for additional information. Hemophilia and von Willebrands will be the main bleeding disorders that will be given factor products. Each type of bleeding disorder will have a specific factor product meant to correct their specific deficiency. Von Willebrand's disease will be corrected with a von Willebrand factor, Hemophilia A will receive factor 8, and Hemophilia B will receive factor 9. It is important to note if the patient has just taken factor for this bleeding event, as they may not need to redose. Prescriptions for factor products are given to patients, and there is a great deal of education that goes along with infusing the drug. There will be instructions on when to use with a minor bleed or when to increase the dose for a major bleed. In the event that there is any question, a major dose can be given without issue. However, please address this with the medic supervisor for complete guidance. Typically, minor bleeds include joints, nosebleeds, cuts, hematuria, muscle and soft tissue, and oral bleeds. Major bleeds include head, neck, abdomen pelvis, intrathoracic, and severe limb bleeds. All head or spinal cord trauma, with or without hematoma, must be treated promptly with the major dose of factor replacement even before diagnostic test or imaging. Hemophilia treatment centers around the country will provide minor major bleed treatment guidance. These instructions can be found on the pharmacy prescription labels or the drug packet insert. Rest, ice, compression, and elevation are also helpful for these types of injuries. This can reduce inflammation to the localized area and provide some relief for the patient. Heat is not advised. It is key to secure IV access before any drugs are reconstituted. Keep in mind an additional supervisor may need to be contacted for port access. The drug prescribed for each patient is specific to their body weight, disease, and disease severity. For that reason, these drugs are never safe to be shared between patients and should never be used outside the expiration date. Please note that many times vials of factor do not match the dosing on the script 100%. This is because some companies do not make exact dosing. There is a plus or minus 10% of dosing range variation with these drugs due to assay availability. Some patients may require more than one vial of factor in order to reach the prescribed dose. Be sure to read the prescription on the boxes of factor. For example, the prescription may state 1,000 IU for minor bleeds, but the assay available on the box can be 1,050 IU, which is within the 10% window. There are several methods to reconstitute factor. Read the directions on a package insert or box to ensure that all steps are followed correctly. Essentially, you will draw up the diluent and inject it into a vial, then carefully administer the infusion to a patient, ensuring you selected the appropriate dose and ensure sterile technique. It is important to take the patient to a hospital that has the training and knowledge in treating bleeding disorders, so that we can make sure they have everything they need to continue their care. Some hospitals may not carry all of the factor products, so it is important to transport the factor with the patient for infusions. In emergencies, the best approach is the simplest. Identify if they have a bleeding disorder, then check if they have the factor with them and have taken it.
We hope this instructional video has demonstrated the unique needs of the bleeding disorder community, and we encourage your team to incorporate what you have learned into your existing program. To recap the major points presented, there are several sites that can cause life-threatening complications due to bleeding into an enclosed space. These include the head, spinal cord, neck, thorax, abdomen, pelvis, eyes, and limb compartments. Suspected bleeds in or trauma to these sites require immediate assessment and intervention. We have developed a 5-count hemophilia assessment in order to provide emergency treatment guidance. Confirm the bleeding disorder and the need for immediate factor infusion. Ascertain availability of IV factor product for infusion in the field. Determine if this is a minor versus major bleed. Identify and secure IV access, keeping in mind the patient may have a central line or fistula. Review factor dose based on bleed classification, mix factor, and infuse as directed. Direct any urgent questions to your immediate supervisor for additional information. Important items to remember: there are a variety of factor products and reconstitution procedures. It is important to follow the specific directions located in the package insert. The Patient's Hemophilia Treatment Center is a great point of reference for any questions. The quicker we treat, the faster we can control bleeding and prevent any additional damage.